Hi everyone, it's board certified plastic surgeon Sean Doherty from Boston. I was recently asked by one of you to do a video talking about mastopexy. So what is a mastopexy? It is a breast lift. So the ultimate goal for a breast lift is to recenter the breast tissue on the center of the chest. A typical patient has had children, potentially has had a weight loss, and is dissatisfied with the shape and size of her breast. Typically the breast sits lower on the chest wall, and the goal again is to bring it up on the center of the chest. This procedure is done in the operating room under general anesthesia and is often combined with liposuction, potentially on the side of the chest, to get an ideal breast shape. Now, some patients also have an implant placed to increase volume, but let's talk about just a mastopexy today. So breast sag is also known as ptosis, P-T-O-S-I-S, and it is graded. And so here is a drawing to show the different grades of ptosis or breast sag. So you see here, this is what is considered a normal breast, and slowly the nipple descends, and this shows more extreme results of ptosis. So again, the goal is to create a nipple that sits on the center of the chest, and the surgical plan is to bring that up. Now, here is a patient who had a very successful breast lift. You can see before surgery, her nipple sits low, she doesn't have a substantial amount of upper fall volume, and she was dissatisfied with this shape of her breast after having had children. So in the operating room, I brought the nipple and areola back up on the center of the chest, cinched the skin together to create a more ideal shape. Here she is on the side. This is a really good example of bringing that nipple back up on the center of the chest, creating what is considered a more perky breast. And here we go. This is the ideal placement of a breast. The incision is around the areola, straight up and down, and then across underneath the breast at the inframammary fold. She is about 3 months after surgery, so she's still healing from her incision. So the mastopexy procedure is a very popular procedure in my practice. It's very satisfying for patients to redrape and reshape their breasts. If you have any questions about that, please reach out. Thanks so much.